In this video, Part 1, Episode 3, the pharmacist demonstrates how to conduct a follow-up appointment.
Hello, John? Hi, it's Alana calling from the pharmacy. I'm just calling to remind you that you have a follow-up appointment with the pharmacist here tomorrow at 3 p.m. Does that still work for you? It does? Okay, great. We'll see you tomorrow then. Bye-bye.
Hi, John.
Hi.
How are you?
Good, thanks.
That's good. Good to see you again.
Yep, you too.
Yeah. We'll just head over here and
Okay.
we'll have our chat. Okay, so John, a cool day today. So how you been?
Been pretty good, actually. Yeah.
Well, that's good. Yeah. So going back over what we talked about last time, I think the first thing I'd like to ask is how's that new compliance packaging working for you?
I think it's helping a lot, actually.
It is, eh?
Yeah, I've
Yeah.
been pretty consistent now.
Okay. Have you missed any?
I don't think, no,
Really?
pretty right
Okay.
on, yeah.
Okay, that's good. So we'll keep doing that then? Packaging it up like
yeah,
that?
Absolutely.
Excellent. Well, that's great. I'm really happy about that. And have you heard what your cholesterol level is?
No, I haven't.
Well, here's some good news. 2.1.
Oh, well, that's
Yeah.
good. Yeah.
So if you remember, it was 3 last
Yeah.
time, and our target was 2.0. I'm going to ask again about any side effects from that medication. Any problems?
Nope, haven't noticed anything different.
Okay. No muscle aches or...
Nope.
Okay, that's great. Well, I think we should keep going with what we're doing with that change that we made.
Yeah.
Okay. Now, besides that change, have any of your medications changed at all since last time?
No.
Okay. So I've still got the 3 prescription drugs, aspirin
Yeah.
once a day, so okay. The vitamin and the calcium.
Yeah.
Okay. And the Tylenol as needed.
Yeah.
Yeah, okay. Still taking that occasionally?
Yeah, once in a while.
Nothing else for any other
No.
medications that you can think of?
No.
Okay, that's good. I've got a copy of medications here. I'll leave that with you, and you should really keep this up to date. So if something does change, just update it here yourself.
Okay.
Now, tell me, how are you feeling? Anything?
Feeling good. I've had a little trouble with constipation the last little
Oh,
while.
have you?
Couple
Yeah?
of months, yeah.
Okay. So just tell me a bit more about that. What's it?
It's a couple, maybe 3 times a month
Okay.
for a couple or 3 days. So
Okay.
nothing happens, and then
Yeah.
when it does, I've got to, strain a bit.
Okay. All right. Usually there's, that's common, and it's usually not a problem. I'm just going to ask you a few more questions just to rule out any serious causes.
Sure.
Is there any blood in your stool, or is it a different color than it used to be?
No.
No. Okay. In between, when you're not constipated, do you have diarrhea?
No.
Okay. How's your weight been? Have you gained or lost?
Well, I've been probably pretty close to what it's always been.
Staying
Yeah.
the same. Okay. And any discomfort or pain in your abdomen?
No.
Okay. Well, to me, John, it sounds like it's important, but not a sign of anything more serious. Okay. Have you tried taking anything?
I haven't. I just figured with everything I was taking, I didn't know whether I should be taking anything else,
Right.
or if so, what.
Yeah. Okay. Certainly, it's good to discuss that before you add anything onto these medications, and before you take anything else. And if you are straining at times, I do think it would be worthwhile to take a laxative just as needed. Okay.
Sure.
I can write down. I'll go out here after and I'll show you what I think is a good medication called Senna.
Okay.
Okay, and I'm just, I'll write it down here. It would be probably 2 tablets. So if you have a day or a couple days where you haven't had a bowel movement, you could take a couple tablets at night, and then usually it starts to work the next day.
Okay.
It's not just medications either, John. There's certain things that you can do with your diet and exercise and water. So I know those are things that you're already doing to help keep your cholesterol down. Just making sure there's lots of fiber in your diet, okay? And lots of fluid, lots of water or juice really helps keep the bowels going. And even exercise helps keep them going as well, okay?
Yep.
So I think if you work on those things, and then if needed, you can still take the Senna occasionally.
Okay.
All right?
Yep.
Okay. Remind you that if you do get any of those symptoms that I mentioned before, any blood in your stool, or if they change color, like a black tarry stool sometimes shows a problem with bleeding higher up in the intestines or in the stomach area, or any weight loss, and if it's your constipation's not clearing up, then it would be time to make an appointment with your doctor and see her. Okay?
Okay.
All right. So I don't have anything else to go through with you now. I don't think that we need another follow-up appointment right away. What we do like to do is an annual assessment or annual review of your medications.
Okay.
So in 9 months from now or so, we'll call you and find another time that you can come in and sit down with us and bring all your medications again.
Sure.
Okay?
Yep.
In the meantime, if anything changes, if you need to talk to us, make sure you give us a call.
I will.
And if we're not available right at this moment in the pharmacy, we'll get back to you. The pharmacist will get back to you and answer your questions. And we can always book another one of these short 10 to 15-minute meetings if something different happens.
Okay.
Okay?
Yep.
Excellent.
Okay. Thanks a lot.
Yes, you're welcome. Have a good day.
As demonstrated by this video, the follow-up appointment is designed primarily as a shorter meeting aimed to monitor the effect of previous changes made. After validating the success of previous changes, the pharmacist confirmed that no medications had been changed or added since the last meeting, and screened to ensure that no new side effects or issues had developed. Any new drug therapy problems that are identified during the follow-up can be addressed accordingly, including the patient, the pharmacist, and the remaining participants in the patient's healthcare team. Certain criteria may prompt the need for additional follow-up appointments, which can be scheduled at this time. Additionally, the follow-up appointment may be useful time to schedule the next annual medication assessment appointment within 1 year's time.